Call this meeting of the Marlborough Council to order. Everyone please rise and remain standing for a moment, Pledge of Allegiance and moment of silence for the armed services. Pledge of allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Brenda, may we please have roll call?
Sure can. Counselor Andrews,
Present.
Counselor Catalani,
Here.
Counselor Flegel. Here. Counselor Coroli. Here. Counselor Rydell,
Here.
Counselor Touche, Counselor Shear,
Here.
Mayor Carpenter. We have a quorum.
Thank you. Just a reminder to all council members, please turn your microphones on if they're not already on. And to also, for everyone to please silence all cellular devices during the meeting. Thank you. All right, special visitors. We have Keith McMinn, Director of Lifeline Penn State Health, is here to discuss the proposed ground ambulance service provider agreement. Good evening.
Well, good evening, and thank you for having me tonight. Lifeline EMS, we celebrated EMS Week last week. We celebrated a 28-year birthday. That's how long Penn State has been providing EMS. We've been in this community over 20 years. And during the 20-year history of Lifeline, we've never really had a contract in place with this municipality to provide the service. As you can imagine, we are very proud to serve this community, but our cost of supply of providing the service have grown exponentially. And I met with the township manager and the assistant manager recently. With me tonight also is Joel Hocking, who is the manager of the EMS operation. He's your day-to-day guy out here to manage the operation. But we met with the manager and the assistant manager recently just to talk about getting a contract in place. And we do take a direct loss on providing the EMS service. The cost of personnel, the cost of the vehicles, fuel, all those expenses that we have just unfortunately do not provide, are expensive. And the funding that we get through billing patients for those transports, when over 65% of the patients are Medicare or Medicaid, just can't keep up. The inflation has really ravaged that. So we are asking municipalities to contribute to help offset some of that service. And I'm here tonight to discuss the contract, the proposed contract, and then answer any questions that you may have. Again, thank you for having me.
Anybody have any questions, thoughts, comments?
Where are most of your costs, your increasing costs? Where do you see that? Is it just
It's personnel.
personnel?
It's personnel, yeah, it's staffing. But, you know, the cost of ambulances, you know, almost $250,000 for an ambulance these days, right? Increasing cost of fuel. As you're aware, we pay a station lease over here at the fire department. We're also asking for some help with that. We've seen models in other communities where, you know, out of the Palmyra station, we not only serve the borough, but we serve the other municipalities, North Londonderry. We respond into South Londonderry and mutual aid. We've seen some successful models in other communities of multiple townships going together and helping the EMS service offset the loss for a station lease. So we're asking that to be considered. We are meeting with North Londonderry coming up, and wanted to let you know that. But I mean, the majority of our costs are in personnel.
Is it, have you also gone down to South Londonderry as well?
Have not. We're not the primary provider in South Londonderry. We do mutual aid, as you're aware. I mean, that's part of the agreement here in Lebanon County, is that we back each other up. So I had initially proposed to the township manager a per capita fee based on current census. That initial proposal was under a 5-year contract. It was $7 per capita for the first 2 years, increasing to $9 per capita for the final 3 years. You know, let's face it, I think none of us expect our costs to go down of providing anything of any service, right? So we usually put an escalator in there. My understanding from communicating with Roger is that the borough counter proposed at $3.50 per capita. I was hoping to meet middle ground with the borough and come to an agreement of starting the contract at $5 per capita. That's what I was hoping as a counter proposal.
What was that price again, sir? What was that again per capita?
$5 per capita for the first 2 years, with an escalation to $7 per capita for the final 3 years. And again, I think our first priority is to just get a contract in place. We've not had a contract. It's actually the only municipality that we don't really have a contract in place.
You already have one with North Londonderry?
So I'm confusing all the smaller townships. I think at one point there was a contract in place with North Londonderry, but it needs to be renegotiated. I'm sorry, I'm confusing all the municipalities. I apologize. Yeah, so that's where I was hoping the borough could consider meeting us in the middle at $5 per capita.
Do we have an ambulance crew over there 24/7 currently?
So we are there most of the time. Certainly would be transparent with the council and provide you the percentage of time. There are times where we have staffing issues, as any department has right now. So it's not, it is a 24/7 operation over there, but there are times where we're short-staffed. Some of the, keep in mind that Penn State Health is a not-for-profit hospital. The profit we make gets reinvested in the capital to buy ambulances and improve our hospital and services like that. So we're not a for-profit agency, but we do need to make money to reinvest in the services in the community. I did get a question at one point from Roger that if we were able to secure a contract, would that help improve the staffing? Well, certainly the additional funding would help us. And to the extent is reasonable, Joel and I would do everything possible to make sure that ambulance is staffed. But I'm asking the council to understand that in today's job market, there are employees calling sick at the last minute and things of that nature that impact our ability to staff. But we would do everything we can to have a 24/7 ambulance in the borough. You need it. Now, we're able to effectively cover this area also from, we have units in Hershey, there's a unit at the Milton Hershey School, but I'm sure you want, the EMS service here. We want to be here.
What's the range of it, say the ambulance is stationed here, what's the range that would be going out to? How far do they travel?
Well, I mean, under the mutual aid agreements, there's no really set range. We do have to back up into Lebanon City from this station sometimes, which seems a decent distance away. This unit will go into Derry Township. When all our Derry Township units are full, we will cover First Aid and Safety Patrol. They will cover us sometimes. So I can't really say there's a set range, but we primarily service the borough, North Londonderry, the surrounding areas. We also have a truck up at the Ono Firehouse, so that distance in between, we're working together there.
Yeah, I can understand the staffing. These guys know I've done fire EMS for over 30 years. I'm recently retired from that, but my ex-wife actually part-times for you guys.
Yeah.
This station, Ono, Anvil, and I know there's days that she's told me she picked up the kids saying, I haven't seen the station since 7 o'clock this morning.
Correct.
You know, they're out and they're constantly going. It's nonstop between transports and emergency calls.
So many of the citizens in this community seek care at Penn State Health. And not only do we provide the 911 service, but as you mentioned, some of your citizens who, after being discharged from the hospital, who can't get home on their own, we bring them home using the ambulance here in Palmyra to do that. So we do a mix of business for you that don't necessarily always involve a 911 service.
Yeah, I got a question. So what's your coverage plan, like if someone calls off? Because if we do a contract, I always look at, okay, are we still gonna have someone there? 'Cause this is a pretty hefty contract here that I'm looking at. So
Yeah.
are we gonna know, like, if someone calls off sick, do you have a coverage plan put in place like most companies do?
So, I mean, the coverage plan is if somebody calls out sick, we're going to call around and attempt to fill that position, or we're going to shift people to this area. We also have an EMS supervisor that works 24/7 in Hershey, so he may come out and cover this area with the EMT, that, if the paramedic calls. So we are constantly, shifting around. We also sometimes bring the Ono truck down closer to Palmyra and split the difference when we're in a mutual aid situation, when the area is depleted of ambulances. That's the supervisor's role, is to know the status of what's going on in the area and then move ambulances around accordingly. We'll move the truck from the Milton Hershey School out towards Palmyra. Might not be right at the station because they're covering both areas in between while maybe the county's depleted. When Lebanon City gets really busy, same thing. We're constantly monitoring that and moving ambulances around to provide the most amount of coverage.
Okay.
Go ahead, Anthony.
No, you go ahead.
So another question, this is coming from my business end of it and that side of what I do for a living. Not asking you to badmouth anybody, but why should we go with you guys other than First Aid and Safety Patrol or Central Medical?
Penn State Health, we have the backing of a large health system. Many of your citizens seek care at our health system. We've been in this community for many, many, many years. Our crews are subject to and have regular oversight by a physician medical director, daily interaction with that physician medical director. So we make sure that the level of care we're providing is the right level of care. You don't find that you don't have that daily interaction with medical director unless you're with like an academic medical center or a health system like that. Education for our staff to make sure that the care that they're providing is good. opportunities monthly for staff to receive additional training, attend Con Ed, that all works towards their certification and renewal of their certification. We also attract top talent because we pay well. As you're aware, that's how you attract good talent, by offering good salary and good benefits. Keep in mind that Lifeline is just not EMS, so we have a community paramedicine program where patients that are discharged from Hershey that need follow-up care in their home, Lifeline provides that as service. We also have the critical care team, the helicopter, that provides that service. Now, you're very close, right? There are not a lot of flights out of the Palmyra area, but it's peace of mind to know we have that level of care. So we're really the only health system in the area that can provide all of those things under the Lifeline umbrella. And we're not perfect, but I think we get it right most of the time.
And you guys got a good NICU and Pete set up too.
So the
That's one thing we do.
Children's Hospital is nationally recognized.
I meant on your transport.
Oh,
for
on the
EMS,
transport,
yes.
correct.
I got a question. So
Sure.
we see, $5, $7. I would really like a breakdown of each of like, this expense is for per person, this expense is for two. A breakdown of how you get to that total amount. That way we can see. Can you do that for us, please?
So Penn State Health, we won't provide a P&L. It's not something we do, if that's what you're
So
referencing.
you'll just give us this amount, but we don't know what the breakdown is, really, what we're paying.
Well, I will tell you that even at $5 per capita, we are still taking a loss on the EMS service.
Oh, yeah, I don't doubt that at all,
Yeah.
but is there some type of overview breakdown that you can give us before we can, I mean, we get $5, $7, but like, what is it? Like, what's per person? Is it $60 or is it $70? What is per person, would you say?
I'm not sure I understand your question. So
So for an ambulance.
we're essentially, so the borough manager gave me the current census of Palmyra Borough as 7830, right? I think that's the number, sir?
Yep, that's right.
So we multiply that number by 5. If you multiply that number by 5, it's 39,160 is what we would be asking for as a contribution. Beginning your next budget cycle, we operate on fiscal year. I understand the municipalities operate on calendar year. We're not asking for that money right now. So with that $5 per capita, again, there are different approaches to how that fee is assessed. That's how Penn State Health does it, okay? Some EMS services provide or asked for a per household fee. We've seen that model also. I've heard per household fees of $85 was the recent one
That was family.
in northern Lancaster County, I believe that was.
It's 70
Right.
per person.
Right.
Family 85.
Obviously, we're at a $5 per capita fee. We're a much better deal, I guess you'd say, than the $85 fee.
So Anthony, like a four-person
I
house.
understand that,
would
but
be
last time I
$20.
checked, money doesn't grow on trees, so I mean, you gotta ask the
Versus
questions, you can't just say yes to everything, right? So, and then my other question is say we don't go, forward with this, what's the next option that, we could still have some type of relationship together?
If my counter proposal of 5 with an escalation to 7 is not accepted, I will certainly go back to my executive leadership for the hospital. I work for the executive leader, and with any proposal that you have. We're not leaving Palmyra, we're not pulling out of there is no current contract, in place. Let's just get a contract in place, that's gonna be important. It covers other things like insurance, and you can put performance expectations on us and things of that nature. None of that is in place currently.
We went through the I'm going back 20 years when Mike Sheasley was running the
Yeah,
HMC.
yeah, we've been over here over 20 years in the
Yeah,
community without a
and-
contract.
The best deal we got was these guys. Lebanon First Aid and Safety and the rest of them in the community around here wanted to charge even worse than that. So before we get your, head out of your butt,
Hey, listen, I'm not gonna say yes to everything. You gotta ask questions. I mean, I'm not someone that's going, oh,
Something
yes.
that should have been
I would
done.
like to see if maybe, you said 5, I would really like to see some type of breakdown if you can, or maybe if you can ask, say, hey, what could we do possible? And then also, could you go down to $4 and then $6? Is that also possible?
That is possible.
Okay.
That's possible, but I'm asking to be able to go back to my leadership and speak with them, okay, and to speak to that.
So part of my concern with this was you also asked about the fire station lease to
Yeah,
go. So I'm trying to balance the needs of our community. And obviously, emergency service is a need for the community.
Sure.
So that's what my thought is, because if they can't absorb that, we're gonna have to come up with that too, which means that $5 and $7 is gonna end up being more.
it's more expensive
So,
too, yeah.
right. So that's where I'm trying to balance the.
So, different communities have done that different ways. There are communities that we still pay a station lease. There are other communities where several municipalities serviced by that particular station go together and help us with that. There are at least one contract with another municipality that they allowed us to assess a higher fee to then take care of the lease and the per capita fee. So we can work with the council in however, whatever way they want us to in that area. I had responded to Roger's email saying none of this is a non-starter. What was proposed by the borough was not a non-starter, but again, we're partners in this community and want to work with you. The first thing is just getting a contract in place. And then we would like some assistance and help offsetting our costs, okay? Because the reimbursements from Medicare and Medicaid are just not keeping up with what the cost to provide the service are. And we're having this meeting in multiple municipalities, the exact same discussion. We know that your costs to provide services to the citizens are not going down either. We're all experiencing the same thing. I'm trying to answer your question as far as what that fee goes to, right? That's kind of what you're asking. I mean,
I have a knowledge of what they go towards. I'm just looking from you of if I can get something on paper, that's all.
yeah. I mean, you know, we have administrative functions, right, to provide the ambulance service, oversight by Joel's team, education, there's training, there's the equipment that we have to replace and renew. Yeah, it would go towards all of those things. Now, we also, in our contracts, provide some additional services to the township, like CPR training and first aid training and things of that nature. If there's any interest, the borough municipal workers, if they need any of that, we would provide those things without any additional charge to the township. We provide, or when I say township, I'm sorry, I'm used to dealing with townships, not boroughs. We would also, ambulance standbys for events that are borough-related, not a third party wanting to run an event here that they need a permit for, right? But, the borough needs us to stand by at an event or something like that. That's included in the township. So it's more than just the 911 ambulance service. Any other questions? I'm trying to answer you best I can.
I appreciate it.
Are you essentially asking the per capita, is it pretty much the same across with different municipalities? Starting at what was originally $7?
So that's the approach that we've taken, correct? But not all the, when, you know, each individual contract is indeed individual. We started with $7 here. Again, 3.5 is not a non-starter, but I thought we would, try and meet you somewhere in the middle is where we were hoping. A $4 and a $6 per capita fee, I would take that back to my leadership to consider that. But not all the municipal, we're trying to get to that point, but, again, 28 years, of providing this, over 20 here. Some contracts were in place, other ones were not. It really comes in all shapes and sizes. I think Pennsylvania, in some of the EMS crisis situations that they have, would be better to set a standard, but that's much higher than me, and at the legislative level, they've taken some steps towards that, but it really, EMS comes in all shapes and sizes in the Commonwealth. And we're just having this same discussion with all of the ones we serve.
What is the contract, what does it really do for Lifeline? I mean, as far as, what's your benefit on that? Is it just that you know that you have a guaranteed place and service and funding?
So the contracts essentially make us the preferred ambulance provider for a certain municipality to serve citizens in that area, most of which seek care at our health system anyway. That is Penn State's strategy with EMS services, okay? We stay within the footprint of our 5 hospitals. Wouldn't make sense for us to have an EMS contract at a municipality that is not close or near to one of our hospitals. This is obviously very key. And yes, we do bring a lot of patients to our ED from this area. However, the EMS regulations require us to transport to the hospital of the patient preference within reason. Okay, somebody from this area that wants to go to Philly, that we're not gonna do that. But if a patient prefers to go to Good Sam in Lebanon, we take them to Good Sam in Lebanon if it's appropriate for that patient. Trauma patients in this area
They're going to Hershey.
come to Hershey, right? Because we're a trauma center. That's regulated, so.
I don't know if any ambulances that run have ever stopped hauling people.
I'm not, right.
Anybody have any other questions?
Thank you for your time. Really appreciate it. If there's any more education or any more information to provide, happy to come back to another meeting. I'll stay in contact with Roger. Yeah, appreciate your consideration, but, you let us know what additional things we need to consider.
Thank you both.
Thank you. Thanks.
Right, I'm gonna open, if you two could just stick around for a minute, just in case there's questions with public comment, okay, if you don't mind. Okay,
I'll
public,
let you go after that, I'm sure you
yeah,
don't want to stay for the rest of the meeting.
all right, public comment period number 1. Just a reminder to please step up to the microphone at the podium, state your name and address for the record, and try to limit your comments to 5 minutes.
Dave McCloskey, 212 East Ridge Road. I'd like to thank you, gentlemen. I've had the pleasure of you taking care of my in-laws with your services. Greatly appreciated. In order to maybe better understand what this fee will help you with, can you explain to us what the average cost of an ambulance run is? Not the specifics, just the overall average cost.
Yeah, so, I'm gonna explain it maybe a different way that can be.
Sure.
Okay. A 24/7 ambulance with staffing and a vehicle in any EMS station for us costs us about $1.2 million a year to run. On average, if it's a Medicare or Medicaid patient, now Medicaid, the state just upped the Medicaid rate, so they've gotten a little bit better, and we're thankful for that. But on average, we're getting about $388 for transport plus some mileage on top of that. So you can imagine there's 1,352 calls in the borough in calendar year 2023, with 65% or a little bit more than that being government insurance. That's a challenge. You do the math on that, and it's very challenging.
And you answered my second question, how many calls?
Yeah, we've had that. And I think, I'm assuming you provided it.
Yes.
So to give you a quick idea, if I can steal the floor from Luke for a second, 99.94% of the time, your 911 coverage is a Lifeline ambulance. So 79 times last year, a 911 call was covered by mutual aid. So it's another service, a non-Lifeline entity coming in 79 times that for 2023. Lifeline covered 1,352 calls. So 99.94% of the time, you get a Lifeline ambulance with an average response time of 8 minutes and 13 seconds. So that's a system status management that we use when we have depth. So you have multiple units in Derry, multiple units in Lebanon County that help assist, even if the 4-8 truck, which is what we call this truck, the 4-8 truck is on a job, we will system status manage and backfill, because there's a 1,300 times a year, there's a request and we cover it. So if you think about that, it could happen at any time. So we want to eliminate that distance in time by moving vehicles around to help cover that need for an ambulance.
That's
So
the backup plan. That's
your depth.
That's the way we back up each other up. Sorry, my eyesight's bad.
You're good.
I experienced this recently, within the last year, where I fell. And when I fell, I've not been right since. I got weird, well, anyway, I'm not gonna go into that. But you know, when you're looking for an ambulance and maybe one pulls up, you feel so much better. And I was left out to lay in the sidewalk till an ambulance got there, so it's important that we go ahead with it.
Without Fred, that might be a lower number.
Yeah, so I think you mentioned it, the average response time from the call to when we're on the scene is 8 minutes, which is that number of 99% and 8 minutes, even with, again, in transparency, we have some challenges with staffing, so even with the challenges in staffing, we have been able to provide good service to the community. So going back to the question of why us, I think that answers part of it.
Greg Reed, 233 East Hazel. I'm a little confused with what you were saying about Medicaid and Medicare. I guess me and Fred are the two oldest people in this room. Okay? you're making it sound like once you get a bill, Medicare or Medicaid pays so much, and that's all you get. That's not true. Because if I get a bill from the insurance company, after Medicaid and Medicare gets done paying, I still have to pay it. What you're trying to say here is Medicare and Medicaid, and then that's all the money you get. And that's not true.
So we don't balance bill. I think what you're referring to is balance billing, and Penn State doesn't balance bill. I think that's what you're referring to, sir, but I'm not sure.
No, no, maybe I'm not saying it right. Hypothetically, if the chief and me get in an accident, we have the same exact injuries. I'm on Medicare and Medicaid. He has regular health insurance. You guys are gonna charge him more than me because I'm on Medicare and Medicaid. Is that not right?
So what you're referring to is if he has private insurance, like through Highmark,
Uh-huh,
and you have government insurance through
Okay.
Medicare, Penn State Health has contracts with all the private insurers in the
Yeah.
area. You are correct that they pay differently than Medicare and Medicaid. They do pay more, correct. And I never, we didn't talk about private insurance. That was not part of the conversation. I only said that a large portion, as we have an aging population.
Right.
A large portion of our transports, if you look at who needs the ambulance, right, it's usually older individuals.
yeah. But the way you make it sound is, once they submit it to Medicare or Medicaid, that's all the money you get.
We only get what Medicare rates have been set.
From Medicare or Medicaid, but
Correct.
then the difference is billed to the individual.
But I don't see that side of it. I can tell you that's not what we.
So,
The-
I think if you have a bill for $1,000 and Medicare's paying $500, you're saying Penn State does not bill,
We don't balance bill. We
Right.
don't balance bill.
they
back
don't
to
balance.
You're telling me Penn State wipes out the other 500?
They pay back all this stuff.
Medicare, we have to accept whatever
Yeah,
right.
Medicare.
And they don't,
It's-
and they,
It's just like a private insurance. The contract with a private
Correct.
insurance
It's
company
very
says,
similar.
we're paying you $10,000 for a gallbladder surgery. That's what the hospital has to
That's
accept.
what we have to accept.
Right.
Yes, sir.
and no other bill is given to the individual.
Copays and, what you're referring to is copays and deductibles.
Right.
That's between you and your provider. That's
That
not-
doesn't go back to
That
them.
doesn't go back to us,
That doesn't go back to them.
no.
Why?
You're referring to.
Why?
That's an insurance.
Well, yeah, that's an insurance policy for co-pays and deductibles.
So what I'm saying is,
I understand where you're.
Yeah. Yeah,
they're really shoving it to you guys.
They are.
correct.
All of us.
Correct.
So now instead of going after
Yeah. Yeah.
the insurance company,
Yeah.
hey, we need ambulance coverage here. This is what our average thing is here. How about ponying some money up? You're coming to the community for money. And I'm not against what you're doing, don't get me wrong.
I understand. No, you're right, what you're referring to is copays and deductibles
Yeah.
that each individual has with their insurance, whether you have government or private insurance. That does not come back to us.
Yeah.
We, the Medicare rates for ambulance have not changed in, at least 5 years, and they haven't kept up with our current inflation now. We believe there's gonna be federal legislation to make change, but that's not gonna occur overnight. It's gonna occur, sometime down the road.
Since Penn State is ponied up with Highmark, okay, right? Okay, I'm pretty sure that's who they are, because that's who I have. But do you ever think that you guys could go to Highmark and say, hey, here and other municipalities that have ambulance service could get some of their money, because they're not going broke, I'll tell you that.
So the private payer contracts, Penn State and Highmark and all the other insurances in the area, we do have those contract negotiations and discussions every year about what they pay for orthopedic surgery and what they pay for ambulance service and all that. Those discussions are had. Those are not discussions I'm involved in, but they are had.
So you're saying they are giving you some money?
No, I think what you're
No,
thinking about
no.
is the amount allowable to be paid under your insurance is the contracted amount.
Oh, okay.
So like if you have a gallbladder surgery, they're only gonna pay $10,500.
If you
You
have
know.
insurance XYZ,
Yeah.
we have a contract with them that says if you're transported to the hospital, this is your copay, this is your deductible, and this is what we're gonna pay for the ambulance bill. And Penn State does not balance bill on the backside of that. We accept what, that's the advantage of an ambulance service working under a large health system.
I think we all have to keep in mind too, if the state does anything or the federal government does anything with Medicare or Medicaid, it's all coming out of our pockets anyway. So they could up your allotment for an ambulance run, but we're all paying for it. So,
And January 1st, they did that, the Medicaid rates, I'm sorry, I said Medicare. The Medicaid rates increased, but again, frankly, they're paying catch up, you know, and they didn't increase the cover of costs. Thank you, thank you.
Unrelated. My name is Rebecca Zalet, 411 East Main Street, and I'm here with several other of the parade committee just to thank the borough and council members for all of the support you've provided before, during, and following each of our parades. This Memorial Day, we had 40 local organizations sign up to participate. It was a really wonderful event. Many community members enjoyed the parade along the route, and we've had a lot of great feedback. We are trying to get ahead of the game this year, so the next parade that we would be planning is the holiday parade. And we are requesting approval for the following date, Saturday, November 16th. It's right around the same time that we held it last year. The holiday parade would start at 11 a.m. With the fall, we like to start it a little bit later, just for weather, a little warmer. Although this past November, it was still pretty warm. The road closure would be 9:30 a.m. to 12:30 p.m. And we would be following the same route, so Cherry from Locust to Green, Green to Main Street to Locust, and then Locust back to Cherry. We had additional volunteers this year that helped with directing parade traffic at the end of the route so that it was a lot smoother. We had a lot of volunteer help additionally in the beginning when the parade participants were staging, and that went a lot smoother as well, so.
can we just do that, or do you want to put it in the form of a motion for the next meeting?
Yeah, it's not officially on the agenda with the new rules.
Oh, that's
I'll
right,
just
we'd
put it
have
on the
to
next-
approve it. to
Yeah.
be-
Yep.
Unless you make a motion to add it to the agenda, and then you can make a motion to approve it.
You mind if we just put it on the next meeting?
That's fine.
Thank you. You guys did a great job, thank you.
Thanks.
And I'm so glad the weather held out.
Yes. Yes.
Yeah.
Yeah. Yeah. Yeah.
We'll
Okay,
put it on the agenda and
okay,
vote in.
We'll vote in 2 weeks.
okay, thank you again.
Does anybody else have any other questions for these two gentlemen?
I do. I won't keep Keith long. So, TC Medford, 77 McIntosh Drive. I do have one question for you, Keith.
Sure.
2023, your shortfall for Palmyra residents. So you have a dollar amount, how much you are short for 2023? Serving this community? I mean, you're saying you're gonna take in, what is it, $23,000?
Yeah, I mean, so again, we don't provide our P&Ls for the animal services.
Well, I'm just-
Even at $5 per capita, the service, the cost to provide the service is more than what we bring in, by billing, patients, and getting, funding from the insurance and.
Okay, that's why I was just trying to get an idea of what you're short, so we understand how much what we give is providing.
So we would have to ask for a much higher per capita fee to break even.
Okay.
If that helps.
So I'm thinking that if, and I'm just, I have no idea.
Yeah.
Well, I think I have an idea, but I'm probably all wet. But even if you had 1,300 calls and each one of those calls cost $1,000, that's 130 right there, and you're asking for 39. So I hope that puts at least in perspective, and I would assume
We all know it's
$1,000 is
$1,000.
low for an ambulance.
I really want everyone to understand, we are very sensitive that of the other, you have to fund fire, you have to fund your municipal workers, we're very sensitive of that. This is a really difficult conversation to have, but it is one of the few municipalities that we don't even have a contract in place to make sure that you guys have the proper insurance, that we have the proper insurance in case there's a dispute or a lawsuit over a delayed, we just don't even have those protections here. We at least gotta get that in place. And then, you know, again, we have to try and, healthcare is really difficult right now, the finances of healthcare. We're asking for just a little bit, a little contribution from each
Okay,
municipality.
I didn't think anywhere, I could cover anywhere close.
Yeah.
That's what my point was, that
Yeah.
that amount of money's pretty
It-
small.
You're
Now,
right, it doesn't.
the community's paying, so they obviously might have a different opinion, but I thought it was a pretty small amount.
Yeah, it is.
Yeah. Okay, thank you.
Thank you for your comments, go Bear.
I'd like to take any other questions for these two gentlemen first, before any other public comments.
My name is Sharon Schickel, and I live on Maple Street, 991 East Maple Street. My question is, well, actually, what I would like to ask is, how much of a percentage would you have of people who would have a hard time paying like $5 to $7 a year? I mean, because we were gonna move to Hershey before, and their per capita, or whatever you would wanna call it, is like $500 a year, and here it's like $4.95. And we've had neighbors move in, say that they had a hard time affording it because they had, high schoolers that were 18 now or going into college, that they had to pay for them also. So I'm only asking this because I was diagnosed with breast cancer, and 2 weeks after I had my last surgery, I was working at Cedar Crest High School. I worked at Palmyra and several of the schools too before, and then I got COVID, pneumonia, and I was sick for 6 months. I finally went back to work and was training someone, and like a year and a half later, after I got it the first time, I got COVID pneumonia again. So we ended up using the caring cupboard for a while. And I'm just saying, if there are people that really would have a hard time paying $5 to $7 more a year, would it be a possibility that the people who could pay like 50 cents more per family to offset that and give them vouchers or something? I mean, if that would be a problem in the discussion for the people that would have a hard time paying for it, I mean, there's vouchers for almost everything else for people that have a hard time paying for stuff, and I'm not trying to be flippant about it at all. But even from not being able to work and having a hard time breathing and going to like 1 million doctor's appointments and having decreased lung function, so I had to retire early, but that at least gives us an income so we don't have to use the care and cover anymore and someone else can, but I'm just saying that, would that be a possibility?
So correct me if I'm wrong here, but what we're talking about with per capita is what we would pay per capita to have ambulance service in our borough. It's not an additional tax.
Okay, so it's not something that the
It is-
residents would have to be
Well,
paid
it
for?
would be.
or-
I mean, it would either have to be eaten with
Right.
it a tax increase
Mm-hmm,
or
Yeah,
Passed
what I'm
along.
saying is we're not putting an additional $5, $7 per capita.
It would be an additional something, but we
Right.
don't know yet what that additional something would be, but yeah, it would be a
would
tax
be an
increase,
additional.
100%.
it would be an additional
But,
per capita,
but,
whatever.
but to your question, I don't think we're allowed to do that. I think there's actual like federal laws in place that we can't, like, for instance, like if this group of individuals over here, they can't, then we're gonna charge these group of individuals more. I think there's actually like a federal law that we can't do that. But what we can do is, to be honest, like, look at this very well and ask our questions and work with them very well and try to come up with the best thing possible for everybody. That's what we can do for everybody here.
That's what we want.
Yeah.
Well, and I think you guys are doing a great job. So, I mean, I'm really enjoyed hearing everybody's input and even the people that, even though I came late. So thank you very much for
Yeah.
caring.
And just
Thank you.
so you know, the borough has about almost a 15% poverty rate
Oh,
in the
I
borough.
understand that. I
Yeah.
mean, I volunteered at
Yeah.
Care and Cover.
No,
and, you know,
I thought that's where you were going at first, and, you know, you were not alone when you were going through a difficult time.
Well, and from volunteering at the Care and Cover and even going to meetings discussing how to better help the community, a lot more people are in that poverty rate now because of either a death in the family from COVID or, you know, different health reasons why they can't. So I do understand that. I just thought if there's a way to
Good point.
still be able to do what you need to do. I mean, because for me, you know, when I couldn't breathe, I think I would have really appreciated, I mean, thankfully I had somebody that could drive me, but I would have appreciated somebody getting there pretty quick because I felt like, you know, an insect that had just been sprayed with insecticide, you know, it
Yeah.
just would help you not feel so panicked if you knew somebody was going to be there to help you. So thank you very much.
Thank you.
Ma'am, if I may,
Thank you.
could I have you sign in to
Sure.
the sign in for it? Because you came in after the meeting, so that'll help me with the minutes. Thank you.
I'd like to clarify a question that someone asked, and that is whether we have a contract in place with North Londonderry. There is not an EMS contract in place with North Londonderry. We will be having the same conversation. My confusion, one of our physicians was the medical director of their police department at some point, and that was a contract that was in my head. I just couldn't remember that, but there's not currently an EMS contract. But that municipality is covered out of the Palmyra station.
And would that be like a contract that North Londonderry and Palmyra could do together, for instance, or are you gonna do two separate?
We would need, them, the way it works in the Commonwealth, each municipality would be the signature on their
Right.
contract. I'm just saying that, related to the station lease, there could be,
That would be,
I don't wanna tell you how to do, right, you as a board need to decide, but one or two of the municipalities we have, there is a joint contract where each municipality has agreed to contribute X towards the station lease in that area. And I think that is jointly signed, but the actual EMS contracts are individual contracts signed by either the township manager or whatever elected official is designated to be the signature. So, and, you know, of course, the solicitors review all the contracts, and in some situations, adjustments have to be made.
We talked about a couple other things that were in the contracts. Are there sample contracts that we can take a look at? Do we have anything like that to give us an idea
We used
of what
to have
else
one.
is involved
we
in the
used to have
contract?
one years ago.
We
You
sent-
gave us
Yeah.
one,
We
yeah.
sent a sample contract to the township manager.
I think that was in.
Yeah, you guys-
That was in the packet.
Just missed it?
Yeah.
Did I
That was at
just
the
miss it?
last meeting.
Maybe.
I just missed it, sorry.
No problem. Happy to send it again if it's needed, but
anybody else have any questions for these two gentlemen before I let them go? Yes, ma'am.
It has nothing to do with this.
Okay, hold on one second. Does anybody else have any questions for these two gentlemen? Going once, going twice? Okay,
Thank you.
have a good evening. Thank you so much.
We're partners. Let us know how we can work with you.
Thank you so
Thank you.
much.
Thanks.
Okay, ma'am, you're up.
My name is Laura Smith. I've been living here for 31 years. I live in 716 West Main Street, Palmyra, Pennsylvania. I have 6 apartments, 4 units on 726, 728, and 2 units, which is a big house, on 708. I failed to read the last borough guidelines, and where it states that if I don't cut the grass, I'd get a fine. So I kept it out pretty good, but there was a period of time where it was raining. I worked from 7 o'clock to 5 o'clock, a regular job. Then I go home, and if I have time, I cut the grass. If not, I have to wait. So there were a period of time where it was raining, and I couldn't cut it. So last Thursday, I didn't realize I cut the grass. It was slightly high. There is an empty lot between 716, which is my property, and then the 4-unit apartments. And it was a little bit high. So I didn't realize this. I come on Thursday, I start cutting the grass, and until Friday, I realized that I get a letter and I get an official from the post office that I have to go in there and sign. So I went there, little did I know that I have a fine, and I get the same letters, and I'm just kind of like dumbfounded. So finally, I get to read this where it states that if I don't cut the grass, I get the fine. So sure enough, until Saturday afternoon, not even when I was cutting the grass, I get 2 envelopes on my property, 716, where I get a fine of $100 for 716 and $100 for the empty lot. And I get another letter that I have to sign on the post office, where on 708, I called the borough on Monday. I tried to plead with them to try to, give me a chance to, because I can afford it. I mean, I pay taxes, and I'm always on time. Between all the properties, I paid $1,300 on sewer, plus the $300 of the apartments. And I know everybody is in the same boat, okay? I'm just pleading with you. I couldn't find the envelope that they located on 708. I still can't find it. I don't know where it went. So I'm just pleading with you, give me a chance, or pay maybe half of it, or I'm not sure. But it's been rough. I mean, I have 2 apartments sitting empty. I don't know when I'm going to be able to rent them. So I'm just asking for, some kind of understanding, because it wasn't neglecting. It was just a matter that it was raining. Just this last week, it rained Friday. It rained Saturday afternoon. I tried to cut the grass on Sunday morning. I couldn't cut it
It was just flooded with water. I cut it until Saturday afternoon. It rained Sunday again. It rained today again. So, I mean, I just want some, some kind of understanding. Thank you.
Anything else for public comment? All right, closing public comment period number 1. Moving on to consent calendar. The following agenda items will be acted upon by a single motion unless a member of Borough Council wishes a specific item to be voted on separately. Approve the minutes of the May 14th, 2024 Borough Council meeting. Approve payment of all bills listed on the April 2024 detailed checklisting report. And approve the treasurer's report for the period April 1 through April 31, 2024.
So moved.
Second. All those in favor? Aye. Opposed? Okay, that takes us to action and discussion items. First one is ordinance number 830, amend chapter 314, streets and sidewalks. Discussion on, and if appropriate, suggested motion to enact ordinance number 830, an ordinance to update the regulations and make technical corrections to chapter 314, streets and sidewalks. Any discussion on that? Thoughts, comments?
So moved.
I'll second that one. All those in favor?
Aye.
Opposed? Okay, and then we have ordinance number 831, create a new chapter 247, panhandling and loitering. Discussion on and if appropriate, suggested motion to enact ordinance number 831, an ordinance to insert a new chapter 247, panhandling and loitering into the Palmyra Borough Code of Ordinances.
So moved.
Second.
All those in favor?
Aye.
Aye. Opposed? Roger, would this one be next then? Or is this discussion?
That's for later.
Okay. Okay. Takes us to reports. I don't have anything. So that takes us to the financial report, or financial statement. Everybody has that one in front of them. Financial statement as of April 30th. Anybody have any questions, comments, discussion? I don't think I had anything highlighted this week. No, I think I'm good. Shoot. Jay, you have anything?
No, I just remembered something with the library report that I forgot.
Anybody have any questions on that financial statement? No? Okay. All right, moving on to the fire department.
Nothing.
Did Chief Dugan get back to you about the lease?
I know they're discussing
Okay.
it. I haven't heard where they're at with it yet.
Okay, thank you.
All right, that takes us to library report.
Which you have, and which I forgot, every year we get a breakdown of the library services for each of the 3 municipalities, and I forgot to include that with this, so I'll make sure Roger gets it, and if you could put it in the next packet, you won't have to wait for that. It'll come in the next package. The library's value to the residents of the borough.
Okay. Okay, police department.
Any questions on monthly report at all? Regional, so far so good, led by Pete, Robin, Headaches, trying to get things synced and able to log in and all that. So by the end of the week, that should all be fixed, hopefully. That's really about it, unless you have a question.
how will these, the April, like, the reports, how will they change? I mean, are they just gonna be include?
Like giving you the monthly reports. No, I'm getting mine, it doesn't. I still have to figure that out, because I was playing around with our record system, and I'm not a huge fan of it. Because you can't break stuff down to annual, Elmira, so I gotta figure out how I'm gonna do some of that.
You'll have fun with that.
Well, if it's a report for the police department, I mean, I guess both
Yeah.
the township supervisors and council will have to understand that it's a combined report.
Well, I mean, I think you should get an overview, then a breakdown with each, that way we can visually see how it is and overall and how it's coming
Well, I
together.
think that's what he said he
No.
can't do.
Oh, you can at all?
The way
Yeah,
the
that's what he
system is
said.
set up, because I've been playing around with that today a little bit this afternoon, and I can't break the calls. I have an idea, so I gotta play around with this. I have an idea, I just have to see.
Okay.
Right. Otherwise, numbers look good, though.
They're consistent.
You know,
Except for the simple assault, assault 8 went up.
People get
The weather.
Yeah,
But it's one of those you
Heat.
can't control when somebody's gonna have a domestic and.
I get it.
I mean,
Or just a flat out
Somebody's
fight.
gonna get drunk and
We have the
idiotic.
other person that smacks somebody in the head with the
Yeah.
crowbar, you have the other person that wanted to pull a gun on somebody and then hit his girlfriend, so you can't plan for those things.
No.
Yeah.
Those just happen sometimes.
Can't blame for stupid.
Talking about crossing guards, Roger, since they're on here. Yes.
Yeah, we've been bouncing back and forth with the school superintendent about crossing guards. We haven't come to a meeting or anything like that, but we laid the three options out, you know, whether they want to continue on under the control of regional department, whether we contract the services out. The contracting services is expensive. He talked to the Anvil folks. They're paying $26,000 for 2 crossing guards. And we have 8. We may not need 8,
Goodness.
but, so that's the other option. And the third option was to have the crossing guards remain with the borough under the direction of the mayor. So, that's the 3 options, and we haven't really, I haven't heard back from
I thought
Bernie
the
since
option of
everything.
being under the regional was not an option. Is it?
It is an option.
Oh,
Problem you're gonna run into there.
yeah,
Your youngest crossing guard is 67, and your
Yeah.
oldest crossing
Yeah.
guard is like 80.
yeah. And unfortunately, that's the way things have been rolling.
Problem number 422.
And you don't have tons of people applying, so.
They're not jumping through windows to get that job.
So, I guess what I'm questioning is why, do other municipalities handle it that way? That it's under the police department and not under the school district?
Which way the rest of the county is.
Yeah, it's usually,
Is it?
yeah.
Yep. We're the only one now, I think.
Actually, Lancaster County, almost all their crossing guards are done through the pay service that they do. A large chunk are doing that. Berks County, there's a large chunk that are just paying the service to do.
Easier than trying to find somebody.
Well, I mean, but those services are probably having a hard time finding people too.
Everybody's understaffed, so
Although they have a better, okay, well, let's,
So, keep the discussion going.
yeah.
There's only a couple more weeks of school, and then you're.
right, and then it's gonna be,
You're gonna have to make a decision
Right.
what to do before August.
right, right.
Because if you're gonna keep them under the regional, then you need to have them become employees.
But if you keep them under the borough, then it
Well-
can kind of stay the same.
Not under us.
No, but if you go with that option, where they be in the borough and under the mayor, do they have to be employees? Like,
Well, he would have oversight.
Employees of something.
yeah. Not fun.
The borough wouldn't really, it'd be under the oversight of Fred.
With the would, the cost change at all, or is it only if you contract out?
Well, the cost would be the same except for the escalation in the salaries.
The issue is then too, you're right, with them aging, a succession plan is not, I mean, that's an issue with everything right now. Those people, those older people, when they retire, somebody has to find new people to take on the responsibility. That's gonna be a problem. Oh, joy.
My. Anything else? Mayor, you got anything?
Yes, I do. Seriously.
Okay.
I get kind of emotional when I talk about it because of what I'm going through right now. But the VA is an organization in this county that's got a lot more respect than what they get. They took me, I've been to so many doctors and so many different rooms at the VA, had acupuncture today, I had it yesterday, this and that. I felt so bad. They gave me full benefits now. So I can't even talk about it without tearing up a little bit. But anyway, they gave me full benefits. I can't talk it. But the VA did a lot to this community, not because of me, but because of what they're doing to other veterans. I mean, well, over Christmas, I was in the hospital for a month. They're definitely for the soldier, and I just can't continue.
I think I can safely say that the people in this county know what a benefit it
When I
is to
tried
have
to
that
get
here.
out, I
They're always
couldn't.
voted one of the top VAs in the country, so.
Trying to get out, I couldn't get out. They gave me my pension, disability pension. I don't have to worry about anything anymore. And they did a lot for me, and I just can't get over it. And
We're glad.
Huh?
We're glad.
That's good.
that's why you see these things I handed out tonight. After they gave me the pension, I went out and had these made. You guys all got a copy. Does anybody in council not have one? Sit down there. Anybody in there, in the audience would like to have one? What they are is a always remember for on the car.
Thank you, sir.
And I said to my wife, I said, if I'm gonna break down and do what I wanna do with this here, then they should get the recognition for it. And that's why I did it. I only have 100, so if you want one, you better see me before they're gone.
I like the graphic.
Huh?
I like the graphic.
You got, everybody got one now.
I want two more. I'm just kidding.
See him after the meeting.
I'm done.
I'll just knock on his door.
Thank you, Mayor. All right. Moving on to the Rec Commission. We had a meeting. We had a meeting on Wednesday, May 15th.
It's a little early for the report to come
Yeah.
out, so.
We should
Well, I
have it by
haven't.
our next meeting?
Haven't seen it yet.
Probably, oh, you'll have it by the next meeting,
Yeah,
for sure.
yeah. This is the 28th, 28th.
Yeah, you should have it by the next meeting.
I'm just, sorry, I'm just curious with the rec, is like, do they have some plans of, because of the sports, like, that's kind of, plus activities, they do camps.
What do you
Is-
mean?
Oh, I mean.
Plans for
they-
what? I mean, they do sporting events all, and
Right,
It's all year
no,
long.
it's like, so plans of like, what are they gonna do, because they were losing a lot of sports, they've lost baseball, basketball, I can see them losing at some point. So like, or do they have any plans put in place of like, what they might do before
no,
that starts
that
to?
hasn't even been a discussion, because it really hasn't been a
I'm t-
concern
a lot
as
of
of
parent,
yet.
a lot of parents have talked to me, and that's just, because Campbelltown soccer, a lot of people going there, Palmyra Youth Basketball, a lot of people going there at age
We had
fourth
discussed
grade.
that before, but there has
Yeah.
not been any discussion on the rec board for that.
I would hate to see something, that's all, because I
Well,
grew
the
up going.
problem is, we rely on volunteers to do the coaching, so
No,
it's,
no, I know, I'm there
you
every
can't
time.
just plop in a lacrosse camp if you don't have somebody to coach it, so.
Oh, no, I coach every
Yeah.
single time. I just was thinking, I just was asking, that's all, because I don't think that's been asked yet, and if they
Yeah,
don't know,
we
maybe
did talk about that about several weeks ago,
what a
wherever
plan
we
if-
were,
if-
yeah.
I remember that.
You were talking about basketball in particular, because you were heading to a thing with your son.
Basketball. I was saying Disney with my son.
No, this was probably several months ago.
Okay, yeah. But anyway, it's just a concern, because I've been here, I just was wondering, that's all, because hearing things and the parents talking to me, so just thought I'd say something.
Okay. Next on the list, solicitor's report. Everybody has the email dated May 20th, 2024, concerning boarding house, rooming house registration inspection in front of them. Anybody not have it? Everybody get it? Jane, you got it?
Yes.
Okay, just making sure.
The last meeting.
So, in this letter, what's the difference between a boarding house and a roommate?
Boarding house
Roommate.
and a roommate.
Yeah, I mean, they're talking
Roommate.
about even one room. So, what's gonna distinguish between it being a boarding house and, somebody
roommate.
who's, yeah.
From what, Roger, from what, when I read this over the weekend and kept reading it, is this more or less referring to like Airbnb, VRBO, like the ones you rent online,
No.
pop in for a
That's
weekend?
that's a different use,
Yeah.
different definition. So this is, it would depend on how you're gonna define it, ultimately.
I was gonna say, we have to be very careful on those definitions, because, I mean, I can think of several instances, you know, your son comes home from college, brings his roommate from college, he wants to stay for the
Yeah.
summer, the parents are sending you money to help.
Right.
Are you now a rental unit?
Right.
You know, I can see a lot of different issues if it's not very carefully defined. I think a rooming, I mean, if you want a boarding house definition, I think it has to be something that's advertised.
American House or,
Right, it has to be something that's clearly advertised, that whether it's on Airbnb as a room rental.
but there
or-
again, that opens it up for a whole
Oh, yeah.
lot of discussion. Because somebody could say, oh, well, he's my roommate, or,
Right,
Yeah.
and does that become
right,
a rental property then?
right.
You know, I just think it would have to be very, very.
I don't know,
clearly
I need
defined.
more time to decipher this, but
Yeah.
Yeah.
I'm,
Was there a reason
Yeah.
that this came about? Was
Yeah,
there an
what's the-
instance, did
Yeah,
something happen?
Your new code enforcement official dealt with this in the city a lot, and I think he's had some rumblings of it here. So he thought so we took a look at this, had Joselle look at it, because we don't really have anything on the books to deal with it if it becomes a problem. Because obviously in your more denser cities, you have a lot of these problems.
I know we had problems with it in Harrisburg City, but, you know,
So
I
that's,
don't know that we really have an issue at this point. And I think you have to tread pretty lightly when you talk about what happens in somebody's home.
Right.
You know,
Agreed.
I don't want, you know, your neighbors don't like you and all of a sudden they're saying, oh, I see a lot of cars, they must have somebody living there. Now a homeowner is defending themselves to the borough. It's like, well, I'm not renting to them, you know, I don't wanna put a homeowner in that position that they have to defend themselves, what they do in their own home.
That's your definition, because you have a rooming house in the borough and it is a pain in the butt. Like, we do go to that place pretty consistent.
Yeah, and I think a rooming house that is clearly defined as a rooming house, as opposed to a
Right.
boarding house.
Because even what he's talking about, boarding house, rooming house, they're kind of the same, because even when I was in Reading, we had tons, I can tell you now, 107 South 5 was a rooming house, and we were there multiple times a night, but I don't think we had that covered under, like, DCRs and the rental agreements, because it would have been nice, but then on the back end, they were very transient, so they were always gone.
Right.
If you're rooming houses, you're probably people.
Yeah, they just have a room they sleep in, they eat out, and they don't, or they.
Well, according to this,
Okay.
they could have shared kitchen facilities. So again, I'm just trying to figure out what's the difference between a boarding house, you're leasing out a room, and having a roommate.
So is there a way that we can designate
But how do you designate?
without including private homes? Like, okay, the two on Grand Street is one thing, that's not a private. Aren't there two? Yeah, both North.
No, that's a
both-
B and B. That's a B and B.
No, it's not. Is it?
Yeah.
Is
The
the one a
Manor?
B and B now?
I'm not sure what it is right now.
The
It-
Walton,
Manor?
the
No,
Walton
yeah,
House
Walton
was a
Yeah.
It
B&B.
was a B&B.
It was, it's not anymore?
We don't know.
We're not sure.
And then the one across the street
That is, yeah.
is.
I didn't realize that turned into a B and B. I thought it was still a
Oh,
rooming,
We don't,
rooming place.
part of.
When the
So,
It's advertised as a B and B anyway.
it was
I know
several years
because-
ago it was not, because I knew someone that was staying
No,
there.
you're absolutely right, it was a boarding house years ago.
So, is there a way we can designate something like those two places that is a multi-unit dwelling but not an apartment without, this is gonna get sticky. This is gonna get real sticky real quick.
Yeah, I mean, that's.
Without turning it into private homes.
Okay, so
Like,
here,
like you said, like it has to be like a
the Manor House
commercial.
is, I think it's called the Manor House.
I thought it was a,
American House.
No.
Walton House.
Walton House? Okay. Thank you.
The northwest
Yeah,
corner.
that is a private house. At least when they opened it as a B and B, it's a private house. Now, that would fall under, that would already be covered because it's a B and B.
Yeah, bed and breakfast
Right.
is covered, yeah.
So,
Okay.
yeah.
Because that requires the owner of the property
And
to live there.
technically, I would assume that the one on the other corner probably has a hotel license.
that's what?
They probably have a hotel license, don't they? Ooh, that's a good question.
I can't answer that with certainty.
So is that the difference in a boarding house, rooming house situation where, as opposed to a B and B, that the owner doesn't live? Is that what happens in a rooming house? I've never been in a
No,
rooming house.
usually rooming houses have
They sort of have like a
Yeah.
caretaker. that
Yeah,
lives
manager or
first, but
something
May
there.
not necessarily be the property owner,
Right.
though.
No, it's not.
They're not up making breakfast for them every morning before you
Right.
go out on the town, you know?
Right.
Yeah, like, you know, like
So
Beth
it's
was
like
saying,
a-
you gotta be very careful how you work, cause like, when I was in the
It's like a
military,
motel, but it's not a motel, it's
four of
a
us,
house.
we didn't wanna live on ship anymore, because our ship was in port all the time, we rented a house, the four of us, and we split the rent.
Right.
You know, that would fall kinda into this, because we're four guys just in one house together, just all sharing rent.
Yeah, I don't know how you define one or the other.
I think
That's
my,
my question.
my biggest concern is if it happens in an individual's home. And does that become an issue? issue.
Right.
You know?
No, I agree.
What's the cutoff for that? And I think it really needs to be thought about and clearly defined.
Yeah, because that's gonna.
And is
create
there a
lot of problems.
zoning issue with that then too?
I don't think we're really talking about zoning here. I think what she's asking in this at the end is, do you want to make it subject to the residential rental ordinance? And if you do, then we have to define.
Yeah,
boarding house, and it-
I can't say yes or no until I find out what's the difference between somebody owning a house and having a roommate, or somebody having a boarding house and renting out a room.
Can we ask her for clarification on those two,
I can ask that, yeah.
please? That might help. And put that back on the agenda for
For the next time.
for June 11th. You good?
Yes, I just need to keep that away from my other stuff, so I remember.
All right, next is zoning officer, codes enforcement officer monthly report. I don't have that.
I don't have one.
Did we have one?
We did have one.
We had one at the beginning of the year.
Yeah.
Month.
Yeah.
Beginning of the year.
Yeah, beginning of the year.
Beginning of the year.
Yeah. we
Nobody
had one
has
at the
that.
last meeting.
Nobody has that.
No, no.
Okay, zoning hearing board, no hearings were scheduled for Monday, June 10th at 5:30. Which takes us to borough manager's report. Roger, you're up.
The building HVAC control project will start tomorrow morning at 7 a.m. So they said it would take probably about 2, maybe 3 weeks tops, so it should be done fairly quickly. The other thing you might have noticed when you came in, the parking lot has been sealed and crack sealed
been
and
doing it.
sealed over. They didn't do the area in front of the garages yet, so I'm trying to track them down on that, so that needs to be done yet.
Since it's your report, I know I need to ask you one question. Have you got any complaints on a candy apple red Camaro ripping up north side? Went past your house the other day, I thought he was gonna blow your doors off.
I heard something about it. Oh, that's what it was. No, I heard it.
I know.
I thought it was just the kid being, it goes sometimes in one ear, not the other. No, I'm just kidding.
Now you know.
Well, we should put another speed trap. Another speed trap. They don't do anything.
We put your signs up in your block and the fastest car was doing 35.
I know. They see it and they slow.
I'm telling you, if they don't see it, they're gonna speed. You guys don't listen to me.
So the answer to your question is no, we have not heard anything about that.
Well, he came up Broad Street to the Huey and went sideways up toward his house just about. Laid rubber everywhere, and I hollered, "You asshole!"
So you have a drifter. You have a drifter.
What time?
Qualifier.
Impressed he didn't hit anything. If he's
When
doing
was
that
it?
middle of that
Sunday?
street.
When was it?
Friday.
Friday in the afternoon, because I'll make sure I'm outside next time. I want to see, I'll yell with you.
It was a candy apple red Camaro.
Okay. All right.
Okay,
I'll sit outside.
great. Anything else for borough manager's report?
Yeah, one other, Southeast Park, we have a person that would like to donate, I guess, a dog waste station. It's basically a post with a bag dispenser and then a little trash can attached to the post. I talked to Public Works about it, but they don't think it's necessary, but we're willing to try it if you folks agree to allow them to do it. Apparently, the folks live near the park, they always took their dog named Onyx there, and he loved to play ball and stuff there, so they would like to donate this thing to us, we just have to install it and then empty it from time to time, so.
So donate. Free.
Yeah. So, just
very
wanted, just
Yeah.
get your opinion
kind of
on
them,
that.
and
Yeah,
I don't have an issue with it.
I don't have an issue
yeah,
with it.
doing it, that's
I think
awesome.
it's very nice that they would do it, and if
We
it gets
appreciate
used,
that.
great, and if not, great, it's still there.
And if it becomes a problem anyway, we can just.
I'm
remove
assuming
it.
that Onyx is no longer with them, is that
Yes,
why?
that's correct.
Aw.
Onyx has passed away.
That's nice.
Scott thought maybe in lieu of doing that, maybe they could buy a tree, we'd plant a tree, like a memorial tree for the dog.
If you want to suggest
So,
that,
I
that-
don't- but-
but that's,
That Onyx would have used.
yeah.
Then get a picture too.
yeah, I think it's a nice gesture.
I think it's nice too.
We'll get back to him on that. And the last thing I have is we just received today from Joe Zell, it's copies in front of your, it's for the ordinance to adopt the 2024 property maintenance code.
Right here.
So that's just for your reading pleasure for the next meeting. I do have a PDF copy of the 2024.
Yeah.
If you guys
this
would like
is
to
the
see
one.
it, I can email it to you. See what's in the code. Like, you can kind of see what they've changed over the years. They kind of highlight things in colors.
Yeah.
Yeah, sure.
Fun reading.
Might get bored when school's over, you know, might need something to do.
Other than that, I think that's it for me.
Anybody have anything for Roger?
Yeah, Roger, I was doing some research and I actually was having Brenda copy something. She said that we've looked at this before. Our streetlights with going LED,
Oh, yeah.
it's
an-
definitely, it's a big savings if we could
Oh,
do
yeah.
it, but she said there's been a fight with Med Ed. I mean, have we gotten anywhere with that?
Well, the problem is, they own all the lights. We don't own the lights. If we owned the lights, we could do whatever we wanted to, but we don't. So they have a program to upgrade lights. We can't, and they won't do them all at one time.
That'd be too easy.
They're only gonna do like 10 at a time.
Yeah, I think it's like,
And you've got to kind of group them in an area where the useful life of their fixtures is over. They'll replace them for no charge. But they need to be grouped together. So it'll take us forever to get through that at 10, 20 lights a year. And like I said, they have to, you can't like replace 3 over here and 2 over there, you know, that they want them to be together. And the problem is, as the years go by, the lights go bad, they replace them, that starts the useful life clock over. And I have a whole list of all of them. And to try to go through that and try to group them together, because we can replace the ones that are newer, but they have like a depreciation fee left on them, so we would have to pay that.
And it
So
was,
it's-
that was a pretty decent
it's-
chunk of money, if
yeah,
I
it
remember
is.
correctly.
So that's why you're not replacing the one by my house. You're letting it out for a reason. I get it now. You're gonna wait till the whole block goes black and then you're gonna
They're not
replace them.
making it.
That's the plan.
That's the
That's-
plan.
I mean, it would be man hours too,
It
to
makes
figure out
sense
how
now.
to group these.
Yeah, I mean, I haven't spent a ton of time,
Yeah.
but when I start working on it, you can,
Yeah.
it becomes a time.
no, I was just wondering, because I know it's a considerable cost savings to have them in there on our end of it with the electric bill by the end.
I had looked in the past, I think we have too many streetlights here, especially on Main Street. When you go down there, it almost looks like you have a fluorescent light tube going down. So I think with these new light fixtures, you could have probably half them. And we talked about having an engineering firm come in and do like a lighting analysis, but we can't really find anybody to do that either, so. Cost effectively anyway, so. The firms that do that like to do that for a municipality that's looking to take over ownership of your lights, because that way you have total control of implementing their recommendations, so that's kind of the tough part.
The utilities are mandated to reduce their usage, right, their efficiencies. You would think if
They
it
would
reached
want to.
the end of the useful life of that light, that they would replace it with an LED without the municipality requesting it to be done.
I agree.
Yeah, yeah, 'cause
You know, why do we have
can't
to
normally
do?
buy a regular light bulb anymore half the time, so it's.
But basically,
finding
what
it.
they're expecting us to do is their work.
Mm-hmm.
And it's not cost efficient for us to do that. They're the lighting people. I mean, they're in the business of electricity, for crying out
Right.
loud.
And they want us to stop the carbon footprint, and then there's a way to do it.
Exactly. PPL has.
Yeah.
Med Ed, no.
So there's a whole process to go through with that, and it's just, it's not an easy thing,
Right.
unfortunately.
It's more of a headache than it is a.
It is. It's something I've wanted to do. I was hoping to have all the LED lights here by now, but it's just not.
It's not working out.
It's not easy. It's not a quick and easy thing.
They may own them, but you pay for them to light them.
Yeah.
So their thought is, if you want cheaper light expense, you'll do the work for us.
There you go.
Yeah.
Answers that question.
Yeah. But now you have the answer. Anything else for Roger? No? Okay. All right, communications. Letter dated May 17th, 2024, from Jigar Patel, 116 East Broad Street, requesting council consider paving Shellbark Alley and also to lower the speed limit on East Broad Street from 35 to 25. Thoughts, comments, discussion?
I has been curious, so how come our side streets are a higher speed limit than our main street? Because it's 25 down through the main drag, but then our side streets where our kids play are 35. It's always been curious to me.
PennDOT Road?
Is Broad's not a PennDOT road, is it? Or is it? I don't know.
Just any unmarked borough street is 35, kind of like an unmarked highway is 55. So if you want to change it, you have to do speeds. Well, you can do one or two things. We've had this discussion several times. You can either.
I'm trying to go.
Yeah. You can change every street from 35 to 25 without doing anything. You just have to put signs everywhere, which I think the last time we looked at was like $10,000. Or you can do.
And that was what, 10 years ago?
That was a couple years ago, yeah. Or you can do a traffic study on each individual street and change, then you have to change your ordinance accordingly and then put signs on that street. So that's kind of the two different ways to approach it, but.
Yeah, just curious, because it's always funny, it's our side streets were higher than, and I know, because that's a state highway, they set their speed limit, but.
And they probably set that because it's the downtown business district, so it probably automatically lowers it to 25, I don't know.
There's another thing we could do, put more speed bumps. I'm just
Put
kidding, I
some
know
speed
no one
bumps.
likes speed bumps. But that would be the
I'm
only
gonna
thing.
stay quiet because I was involved with the first discussion on this and it was not good.
I use Broad just about every day going to work. And I do know that from at least Maine to Grant, it is pretty, there's cars parked on both sides. I mean, beyond that, it's not really so bad,
No,
but,
and it's certainly not a narrow street. It
No.
is with the parking. on
Right,
both sides,
yes.
but yeah, but it's, I don't, except for Main Street, we don't really have a ton. Are blessed with slightly wider streets in this municipality than most have.
Yeah.
It's also a curse too, because it costs you
Yes,
more
it
to
is.
maintain.
Yes, it is. Yep, more to plow, more to tar.
Yep.
Yeah, pave, sorry. We don't have the issues that in-town Hershey has where you've gotta get over so a car can go past and, you know, it's.
so I guess to answer his question though, we can't just say, okay, let's
arbitrarily.
change it.
Right.
No, there's a process to go through if you wanted to change just that street.
Yep, $10,000.
Yeah, you just have to do a traffic study on that section. See if it warrants it or not, and,
This Shellbark Alley
Everybody
though,
will
I'm
be
not
in.
really
yeah.
exactly familiar with this,
Yep.
but is this on the list that we know of to be?
We don't pave alleys.
I hear several requests every week to pave alleys, and yeah, it'd be
Yeah.
great, I'd love to pave all our alleys, but we have 28 miles of alleys,
Yeah.
so. And we've got lots of main streets that still aren't paved yet, so we're making
Still trying
progress
to
towards that, but
maintain
we're
our
not there
streets.
yet.
Are we, you said something about paving the one next to Rainbow Snow there? Are we
Yes,
still-
those couple little legs that, we're gonna pave that in-house.
That hole came back.
Yeah.
I go that way, and I'm like, in the morning, like, great.
We've had that conversation
Mean.
Yeah.
times.
Unnamed alley.
Yeah, yeah.
did the millings, I guess, on ours, Shellbark and Plum by us. And I mean, I've asked to have them paved as well over the years and gotten the same response, no. But the millings work well. And what I have found, what I appreciate that it's not, we don't get the traffic speeding through. The areas that are paved, the people are shortcutting through the alleys. Well, you know, we got potholes and gravel and stuff, so they don't race through our alleys anymore. So it's got goods and bads.
Would putting millings down be an option?
We did.
They did a good job
On-
on Shellbark and Plum.
on this
by
one?
us. They did a nice job.
Or did they have millings already here?
We did that when we put the injection well in. There's an injection well.
Okay, so they already have the millings.
The situation with this is the guy's driveway, where it meets the alley, there's an issue there.
We had that, no, that was North Avenue and Angie Reiner. And Darrell Gerber.
Yes.
We had issues with that.
Okay. All right,
Real quick, how do we normally respond to someone when they write a letter like this? Do you just get back to them and tell them that we discussed it, or how does,
I can, certainly.
I
Yeah.
mean, like?
We don't get a lot of these, honestly.
Oh, okay. I was just curious.
okay. All right, any other business? Chief, got anything? Mayor, you got anything else? Okay. Marcus, got anything? Bruno? Jane, you got
No.
anything? Anthony?
I just wanted to ask, any type of update on that clock? Cause like, I drive by a lot, and someone did mention, like, you know, the names are on there, but you can't see anything, so I feel like we need to start thinking about like a plan B with that, because it's just not a good look for the town to have the wrong time. People are gonna be like, oh,
You obviously are not from Lebanon, because Lebanon, that one clock out, right on Cumberland Street by the old bank there,
Oh,
has
yeah.
not worked in probably 50 years.
No, that's.
Mine has frozen in Lebanon.
I know the time's different
That's
now,
good for
and
Lebanon.
it moved.
But in
Yeah.
Palmyra, we like to, I don't know, and then if they could bring the bushes down, if they wanna then see the names, but you can't see anything.
Yeah, we can rip those, the bushes out, it doesn't matter, but the clock, there's 3 technicians in the entire country. 3. And I'm sure they have a lot of clocks scattered around the country, so.
Sorry, Anthony.
Palmyra's not high on their list.
Yeah, I don't know when they're gonna get back.
It almost looks like the same clock that's in Lingelstown that they have there.
I've noticed that. It looks very similar.
Looks very
There's
similar.
only 2, maybe 3 of those types of clock manufacturers, so.
It looks very similar to the Lingelstown clock.
Yeah. So no, I don't know.
I'd ask, no, I'm good.
Can we take the hands and make them 9/11 like it is in our logo?
I was just,
Oh, it's still running, it's
just
still
let us
running,
stay.
it's just,
It moves on occasion.
Yeah.
Time's different every day when you go by.
I haven't seen it moved in a couple days. Every time my kid asks me time, I say, oh, we're on time. I
Next
say,
week, I'm gonna
"You
go
too
and
early."
move the hands, just to mess with him.
All right, I'm good.
All right, Roger or Brenda, anything? Okay, public comment period number 2. Again, please step to the microphone at the podium, state your name and address for the record, and try to limit your comments to 3 minutes. Mr. Barry?
Don Barry,
I don't remember your
711
first
North
name.
Grand Street. I think if you look it up, Med Ed doesn't generate electricity anymore. They are just an office that
Provider.
gives you a bill. And if Exelon ever does anything with 3 Mile Island, which they're allegedly going to start up, maybe your rates will go down. Do we have an update on Melrose Place?
it's under construction.
Where's that construction going and how quickly?
Oh, I left mine at home. We had a,
I know they're moving dirt.
Yeah,
Every now and then they make noise, and then there's nobody there for hours, and then they make noise again.
They get long breaks.
they're supposed to be done in beginning of October with this phase, with the infrastructure, not building houses, but putting the road in and all the
I
infrastructure.
heard an ugly rumor they're trying to buy the next property over.
Probably. I know he expressed interest in that before.
Nice, okay. Do we have a plan on where the stormwater's going yet?
No,
On the hill.
they're still working on the quarry levels in the model. Hopefully by the end of
Oh,
June.
you mean what, under Ridge?
ARM Group, yeah.
Okay. And I'd like to reiterate what the mayor said, the VA has stepped up their game in the last 10 years. They're doing wonderful things. And
Well, I'm going out tomorrow.
just, and the people at the Gap, the things that they take care of out there and the VA takes care of is wonderful. I deal with that on a weekly basis.
I'm going out there tomorrow. Taking the rest of mine out, and those guys are flop all over me. I just ordered another 100.
Great. Anybody else for public comment? Going once, going twice? Okay. Borough Council will conduct its next public meetings on Tuesday, June 11th, 2024, and Tuesday, June 25th, 2024, beginning at 7 p.m. Motion to adjourn.
Motion.
Second.
All those in favor?
Aye.
Opposed? Meeting adjourned.
8:45?
Yep.